Knock, knock.
Hi.
Hello, Dennis Rosenthal.
Yeah, it's me.
Hey, how are you? My name is Camilo. I am the treating physiotherapy today.
Nice
How
to
are
meet
you
you.
feeling?
Not too bad.
That's great. Sorry, Dennis, I'm just gonna have a seat here. Do you mind if I have a seat here?
Sit whatever.
All right, cool. Sorry, Dennis. As you can see here around, you will see my assessors X and Y. This is an exam situation for me. They are assessing me, so I just want to make sure you are okay if they are stay here.
Yeah, no
Cool.
problem.
Look, Dennis, my session is gonna take about 45-50 minutes. It's gonna be split in three parts. First part is gonna be me asking you questions just to get to know you better.
Yeah.
The second part is gonna be some hands-on assessment, and the third part is gonna be um, exercises. So how does it sound for you?
Yeah, sounds good. Yeah.
Sounds good to you? Great. Just Dennis, just to know that I am with the right patient, can I have please your full name, date of birth, and age, please?
Yeah. Denise Rosenthal. My
Mm-hmm.
date of birth is 13th of July of 1991, and I'm 39 years old.
That's great, Dennis. Thanks for that. Thanks for sharing. Before we can go ahead, Dennis, I have just quite a few information here, not too much. So just want to make sure your overall health. So in terms of that, I would like to ask you, do you have any medical condition?
Not really.
Mm-hmm.
No, not really.
All right. So you don't have any heart disease, high blood pressure, lung
Mm,
disease.
no, not at all. I've been like gaining some weight the
Mm-hmm.
last 6 months,
All right.
like quite a lot. I think it's because I've been visiting like some dietitians and they say maybe it's related with my stress at work, things
Mm.
like that.
So the work is pretty stressful at the moment.
Yes.
And how are you coping with that, if you don't mind me asking?
Not too bad.
Mm-hmm.
Well, like with this, at the moment it's very stressful because like they are firing a lot of people. They are
Oh
laying
wow,
off.
laying off.
So laying off people. So I'm kind of like trying to
Concern.
keep it and that's a bit worry every time,
Mm.
and with this problem at the moment I'm trying to like be a bit um, I don't know, like I'm not taking much care of myself because
I get the point, Dennis. So if you don't mind me asking, please let me know if you are stepping any boundaries. But how are you coping with this stress at the work or this stress at your job? Are you coping well? Do you think you have all the tools to get over it, or?
yeah, been trying to do a few like psychological like treatment in the
Mm.
last 6 months to help me with that, and it's been very useful.
Okay,
So
Dennis.
I feel like I'm doing pretty
That's all
good
right.
so far.
That's all right, Dennis. Are you taking any regular medications?
The doctor, I visited the doctor like 2 weeks ago, and he said that I can have a Panadol every time if I feel that I need it. So
Mm-hmm. And are you taking Panadol on a regular basis?
yes, like sometimes when I feel like struggling to fall asleep, I take, or if I know like the day is gonna be quite busy,
Mm.
I take it because I know it's too painful when
All
I
right,
move.
Dennis. I know you're a nurse, so you are like of aware of what regular basis means. So I just want to make sure you are taking Panadols each 6 hours or each 8 hours, or
Mm,
is more like when you know it's gonna be painful or you
yeah,
know it's
as soon
gonna.
as I start to feel like something, I take it straight
All
away.
right. So it's more like the fact that as soon as you start thinking or feeling pain, you take a Panadol.
Yeah,
And
that's
you
right.
and you reckon that works well for you? I mean, the Panadol is working, is reducing your pain, is letting you do more stuff,
Yeah, it's been helping me a lot.
or is quite useful?
It is
Sorry,
useful.
useless.
It's useful.
Useful. Cool, cool. Good on that. Um, yeah. So you're not taking any medications. You don't have any medical conditions previously. Are you smoking or?
Sometimes, yeah. Now, like every time that I have breaks, I try to like because I feel like I'm very anxious, so I need to like do something.
Get it, Dennis. Get it. There.
So
So
it's my also way to like have some breaks in between.
yeah, sure thing. Well, Dennis, it is my duty, as a physiotherapist, to let you know that the best thing to do in terms of healing and in terms of overall health is working towards reducing the smoking or smoking cessation, actually. So I just want to know, Dennis, and please let me know if you are not comfortable talking about it. Have anybody talked to you about the benefits of quit smoking, of smoking cessation?
Well, for sure, like I'm a nurse, so like
I'm pretty sure.
I know everything, but at the same time, it's the only thing that it's helped me to like I don't know, just to sit and like have a quick smoke or break, and that's it.
And what about Dennis? Would you be able, or would you be, I don't know, happy to just have a chat with somebody that could, get you? Because at the end of the day, Dennis, anything or any injury that we have, or because you are a nurse and you probably know this, but if you are smoking, your overall health is not the best, and at the same time, if you have any injury, the healing time is much prolonged, so it's going to take longer. So I'm not saying you need to stop smoking. I'm just saying, would you be open to have a conversation or have any source, any kind of resources outside that can lead you with some information. And
Yeah, that might be
well,
alright.
how does it sound to you, Dennis? I know it's sometimes it's hard, but I just want to let you know that there is a lot of help available. Just to be aware, or maybe get some sort of help in trying to reduce or hopefully quit smoking. How does it sound to you?
Yeah, I will give it a crack.
Give it a crack. That's great, Dennis. And what about alcohol? Do you drink alcohol?
Not really. I mean, nah, sometime on the weekends, but like not on a regular basis. I feel like I'm doing pretty well with that.
Cool. And those weekends that when you have the opportunity to have a drink.
2 or 3 drinks,
All
like
right.
but like no
Fair
every
enough.
no every weekend. Like if I have something social to go.
Cool. So it's alright, Dennis. You can keep working on that and keep towards the same goal. So keep there or reduce as much as you could the alcohol intake. That's great as well. I know this sometimes could be a little bit annoying that somebody tells you about it, but as you could know, all the health professionals, it's our scope of duty, our duty of care to let our patients know about it.
Yep.
Okay?
Yeah, absolutely.
All right, Dennis. Moving ahead, I know you're a nurse, and I just want to make sure, what does your role involve as a nurse?
Oof, I do everything pretty much. I have to move some patients. I have to prepare medications. But like what the things that are more uncomfortable for me is like the long hours that I work there, and like yeah, because I have to do everything, especially when it means like to move patient or try to go for them for a walk or things like it needs to involve like some heavy lifting with them especially, or like yeah, those things. I have to move some stuff, and those repetitive movements really affected me, like
Get it.
increasing my
Get
my
it, Dennis.
level pain
Your
level.
shifts are 12 hours or 8
Yes,
hours?
sometimes 12 hours, sometimes even 24. It's depending, like I change every time.
Okay.
And I'm trying to work as much as I can at the moment.
All right. You told me something that is important. There is some issues at the work, meaning that they are fighting a lot of people. So probably, I don't know, how are you managing with your injury or the problem with your shoulder? But have you ever think about giving a sort of a rest, or moving your duties to something that is less demanding on your shoulder? Are you able to do something like that?
Like a light duties, this is what you mean?
Yeah, lighter duties. You like to try to offload a little bit, your
Well,
shoulder, and try to.
that's one of the biggest problem at the moment, because like um I probably in a normal like job I could, but at the moment, how I know like they're firing a lot of people, I definitely cannot do that at the moment because I feel I could be the next one, and I
Yeah,
need
no.
to really keep
Thanks
this
for
job.
sharing that with me, Denise. I can imagine how hard could it be, you know. So let me go ahead with my assessment, and this is something that I want to discuss after with you. All right. Uh, I'm just gonna take note of the job because that's something that I want to have a sort of a chat after our session today.
Yep.
All right. How do you live with Dennis, if you don't mind me asking?
I live with my husband
With your husband.
in a two-story house. Yeah,
Cool. Are you finding any problems with your daily activities in relation to your shoulder? Is your shoulder stopping you from doing your daily activities like showering, I don't know, getting dressed or stuff like that?
yeah, like
Cooking?
I have some like when I try to reach my like head from here. I'm trying with this because I don't have any problem, but this one is like very uncomfortable to do it. Or when I have to like lift some like my the kettle if it's full of water,
Mm-hmm.
it's something that it's annoying me a lot.
Mm-hmm.
So
I know.
I'm trying to don't do it.
So far, are you independent on those, or are you
Yeah, like
finding
I
that?
have my husband to like help me with those stuff, but like still like I know that it's something wrong in there.
Yeah, sure thing. Um, yeah, because I'm asking this, Dennis, just to find out if you need some external support, but you already told me that your husband is giving you a hand whenever you need. So you are coping well with that, or you think you need plus any other sort of external support to get you dressed or have your showers done or
No, no,
get you
no.
dressed?
I think it's not too bad.
Okay.
Yeah, no, I like to keep my privacy or
All
like
right.
I
Do
can
you live in a single story house, double
two
story?
double.
And do you find any problems going up and down from
Not
the
really.
ladders?
No.
Not at all. All right, cool. So it's just at the moment it's just the work that is the main issue, and probably reaching out, reaching up. You know, the
Yeah,
overhead
at home
movement.
I notice when I have to lift like the kettle if it's full of water, when I
Yeah,
have a shower, or if I want to sleep like in
on
this
that side.
side, and I can definitely feel it. So I'm
Sure
like trying
thing.
to.
Dennis, apart from your job, is anything else that you want to get back to? Like any, I don't know, any hobbies or activities that you are not being able to do now and you want to go back to?
Well, at the moment, like my main focus is like to keep the job, so trying to have like probably less pain while
Mm-hmm.
I'm keeping like because I have to work a lot
I know.
and I don't really have a lot of free time to do like something specific. But yeah, I usually play some tennis, and but definitely with the pain that I have now, I don't even think about it.
So probably tennis will be something that you want to
Yeah, in
go
an
back to.
ideal scenario when I have more free time would be ideal, but it's not really on my goals
All right,
at the
but
moment.
that's something that you enjoy to do, and
Yeah,
obviously your shoulder is not going
ready.
with you.
No,
It's not well
absolutely
enough
not.
to help you with that. All right, Dennis. I will just try to rule out a few red flags, meaning that some stuff that we, or some illness or some findings that we need to look further or investigate further. So, have you ever experienced any night sweats or chills or fever?
Not really, no.
No, any unremitting pain, chest pain, or calf pain, or
No, not at all. No.
any weakness, sudden weakness in any side of your body,
Nope.
headaches?
No.
No. Problems with your bowel or bladder?
No.
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 All right. Any problem swallowing or with your speech?
No.
Good. Great, Dennis. I think that I have a big picture of what's going on here. I will certainly do some hands-on assessment just to confirm what my MRI, sorry, your MRI is showing. Are you aware of what your MRI showed? That you know the exam that you did on your right shoulder?
Not 100%,
Not
but like
100%. Well, what I found from the report is that your MRI of the shoulder showed that there is one tendon of the muscle that it's called supraspinatus, which is part of the rotator cuff.
Yeah.
That tendon is still attached to the rotator cuff footprint, but there is a small tear there. So that's the problem. That's one of the problems. The second one is that the subscapularis, that is also part of the rotator cuff, there is some process there of tendinosis associated with a cyst, which is nothing for concern, but it's probably adding to the shoulder problem, the shoulder pain. And yeah, that's it. And some hypertrophy of the capsule of the AC joint, meaning the clavicle and the acromion. There is a joint in between, and there is a small thickening on that joint that is probably adding more to the pain, or the fact that there is some issues around that shoulder.
Yeah, right.
All right.
Mm-hmm.
So, in terms of that, I will be doing some hands-on assessment just to confirm what I'm expecting on your shoulder, and then we will, do some exercises. But before that, Dennis, I want to ask you, what are your goals for today's session? Like a short-term goal, meaning just today. What do you want to achieve today?
Well, I would like to reduce the pain.
Reduce
Yeah.
the pain. Okay. And is there anything else that you want to add for today's session?
Just like maybe start like knowing what if it's any movement that I should avoid, like or like
Right.
how I can improve like more in a long term. Because I know the pain could be like just something, but
All
it's
right.
been going on for now like the last month.
Cool.
So
And what about the long-term goals? I can imagine from what you said, just going back to your previous level of function, meaning going back to work and be able to do your stuff with no pain. That's something that I can imagine. That is something that you want to achieve. But uh, would you like to add something else, like a long-term goal?
well, yeah, like I say, if I want to play maybe my sport, which is
Mm-hmm.
tennis, eventually, like I would like to be ready to play that.
Okay. Okay, I told you before that it was gonna be something that I want to talk to you about, job related, issues, because from what I can see on your MRI, there is a small tear of the tendon, and what we will need to do in order to allow the body to heal is try to reduce the load of that tendon. What
Okay.
does it mean in general terms? That I want you to start doing activities, keep doing activities, but not overexert you. Meaning that I don't want you to do activities that produces pain, because that pain is telling you that you are overstretching that tendon, and that healing is not taking time, because we need to give some time to that tendon, to that soft tissue to heal. And if we keep loading, if we keep lifting heavy things, if we keep rolling patients, it's not gonna be a good outcome for us. So why I am telling you, it's because probably it will be a good idea, or even I can help you in that matter, to have a conversation with your boss, with your employer, and let them know what's happening now, what is going on your shoulder, and try to move you from these heavy duties to some lighter duties. I know at the same time this is something that is very complicated for you. So what I am offering you is write a letter stating what have I found on your shoulder and the reasons behind trying to move you from harder duties to lighter duties. And yeah, because as a physiotherapist, I need you to reduce the load on that shoulder, but not stopping you. You know what I
Okay.
mean?
Yeah.
I don't know. I mean, this is at the end of the time. At the end of the day, it's up to you. You are going to take the final decision.
Mhm.
But as a physio, this is my suggestion.
Okay.
Sounds good to you, Dennis?
Yeah, I mean,
Write a letter and you can hand the letter to your
I've been trying to hide
employer.
this, to be honest, but if you feel like, because what could happen if I,
Well, if you keep doing the same job without having the proper rest, what is going to end happening is that the small tear that you find in your supraspinatus probably could become a full tear or a full rupture, and that means you're going to have to get surgery to reattach that
alright,
tendon to the rotator cuff. But we can avoid that if we keep the right if we respect the healing times and we do the exercises and we try to just allow the body to heal. Yeah,
alright, yeah.
sounds good to you, Dennis?
I'm just scared to get fired, to be
I
honest.
know, I know it's hard. I can think that maybe we can have a because there is some sort of assistance around in this clinic. So there is also a social assistant that could give you sort of support in that term. We can certainly have a conversation with her and maybe she can give you some tips on how to address this problem that because the employer is fighting too much people, you are overexerting you, which is probably it's something that maybe the social worker can advise you on how to manage that and how to address
Yeah, right.
that
Yeah,
problem. Sounds good.
yeah.
All right, Dennis. Yeah, I think that I have the big picture, so I will just want to clarify and want to do some hands-on assessment. Okay?
Yeah.
All right. First thing, what is the shoulder that is painful? Is the right, is it?
Yeah.
All right. Can you lift your left arm like so, please? Up. No problems at all. All right. What about the right one? Okay. Can you do the same but in front for me, please? Okay. There is no problems in your left. I'm gonna just focus on the right. Okay. So I don't want you to do anything. I'm gonna do all this movement here. Is it painful?
Not really.
Not really. What about here?
Mm,
No?
no.
Okay, what about here?
I mean, it's like all the movements, like still, like,
Okay, there is no reduction in the range of movement, meaning that the soft tissue apparently there is no restricting movement. It's more the fact that the muscle is not working, or probably it's because the pain. So my next question is gonna be if you try to do it again, try to raise your hand. I know that you only are able to do that. Is because you feel weakness or you feel that the pain is stopping you from
both.
both of them? Okay, fair enough.
It's very hard for me to reach out, and it's like increase.
Have you ever experienced any problems with, the neck or any radiating pain or pins and needles?
Not really, no.
No? Any sensation alteration in your right upper limb?
Like numbness?
Numbness,
No.
tingling,
No,
pins and needles?
no,
Any shooting pain?
not really.
No? Okay. Can you please, I just want to clear the neck, so can you please bend forward and backward your neck, please? And to the sides. Not a problem?
Not really.
No?
Oh, it's
It's
alright.
not reproducing your pain?
No.
Okay. Can you please look to the left and then look to the right, please? Not problems at all?
That's alright.
Cool. So cervical spine is doing well. Apparently there is only problems with your shoulder. There is no pain on your elbow or your wrist and hand?
No.
No? That's great. Just want to make sure there is no alteration in your sensation. Do you feel normal here?
Yeah.
Alright, what about here?
Yes,
Same? Same here?
Yes, same.
Same here?
Yeah.
Alright. Same here?
Yeah.
Cool. So there is no problem with your sensation, which is great. Um, Next thing that I want to do is try to do some manual muscle testing, and I want you to do chicken wings for me, please. Yep, and try to hold that position. All right. All right. Can you do that for me, please? And I'm going to pull you down. Try to keep your shoulders like that. All right. Good. Can you please do the same by trying to look at me, trying to go back? Great. I'm going to start here. Can you please take your hand to your belly, please? Push. Great. And try to take your left hand to your back and try to, yeah, keep it like that. Just keep it like that. No. What I mean is try to maintain this distance in the back of in your back. Cool. Great. All right. There is no problem with your left shoulder. Let me check the elbow. Can you please push my hand, please? Push, 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 push. Great. Push my hand. Push my hand. Great. Squeeze my hand. Squeeze my hand. Great. Good. Now we're going to do the same with the right shoulder. Okay? Can you please press your belly? Press, 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 press. Press the belly, press, press, press. Great. Can you go back? If it is too painful, just let me know.
That's all
Do you
right.
think you can reach behind?
Yeah.
Cool. And try to lift off the hand. Keep it there. Okay, cool. Great. Subscapularis is great. Now, I want you to keep your hand there and push my hand. Push my hand. Alright. One more time, please. Alright, so infraspinatus is doing well. A little bit weak, but that's alright. Next thing that I want to do is test your supraspinatus. So can you hold the arm there for me? Alright, one more time, please. Okay, fair enough. And try to hold in that position for me. Up. Press my hand. Here. Dennis, come here. Come back. Good? Alright. That's great. Now, what I want you to do is try to do this movement for me, and I'm going to resist your movement. Up. Forward flexion. Up, 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 up. Okay. What about here? Great. And I think that I already did the external rotation, so that's all good. I did the empty can. Just want to make sure one more special test. Relax, and I'm going to move the arm here for you. If you want to, lay back on your chair. Is it painful?
A little bit, yeah.
Just a little bit?
Yeah, it's boring.
Painful. Alright. Yeah, probably what I am seeing here is effectively that there is a pain, obviously, especially in the supraspinatus muscle. But the good thing is that all the other rotator cuff muscles are working well. You know?
Yeah.
Are you following me?
Yeah.
Are you with me? Cool. Great, Dennis. So yeah, supraspinatus is the muscle that has a tear, so that's why you have reduced strength, and is showing weakness and painful when we test for that muscle. All right. So what my plan is, start strengthening the rotator cuff muscles, meaning that we're going to work on external rotation, internal rotation, anterior flexion, posterior flexion. Sorry, extension. And yeah, trying to work on isometrics You know what isometrics are?
Not sure.
Not too sure? Alright, just give me 1 second. Okay, then keep going. I was talking to you about exercises. So what we are going to do now is it is called isometric exercises. And it's called isometric because you are going to have muscle activation, but there is I don't want any joint movement. All right? Let me explain this for you. So if you want to stand up, please, for me. I'm gonna show you some isometrics, but I'm thinking to do something else before. I want to start doing some range of movement exercises. Okay? So this is something that you are going to do in your home exercise program. So I want you to keep in mind what are we doing now, because it's going to be the same that you are going to do at home. Okay? Cool. So I want you to take a chair with your left arm, like so, and you're going to do what it's called pen write exercises. I want you to write your full name, you know, like drawing the letters on the air. Sounds logical to you?
Yeah.
Okay, so you're going to do Dennis, and I want you to start doing in pain-free. If you want to do with your both feet at the same level, keep your back straight. Okay. Is it painful?
Not really.
Not really. What is your level of pain now at this moment?
2, 3.
2 to 3. Okay.
Same like before.
Okay. I want you to do 10 back and forth and 10 side to side. All right? Ten back and forth and 10 side to side. All right? Any pain with that?
And I got that way a little bit.
A little bit.
Yeah.
All right. That's something that we want to keep in mind, Dennis. I want that the pain is. I want that the pain guides you. Does it make sense? Meaning that I don't want to go over 5 on your pain.
Yeah.
You can still do your activities, but if you feel like over 5 or even a 5, I want you to step back and do less, reduce the load.
Yeah.
So that means showering, or try to do with the other arm.
Yeah.
If you can't do it, or if you need to get dressed, try to put the arm first and then help yourself with the other arm. Use your left arm.
Yeah, that's very
Okay?
tricky. Yeah.
I know it's tricky. Same is in your work. Try to do things that goes to between the pain, with the pain between 0 and not over 5.
Yeah.
Make sense to you?
Yes.
All right. That's the first thing. Second exercise that we're going to do now is with a stick. Do you have a broomstick at your home?
Yeah, sure.
Or maybe any stick that could help you?
Yeah,
All right. Just give me 1 second because I have to come to the. All right. I already got it from the lab or whatever thing. What is that? Okay. All right. All right. What I want you to do is put both hands here and try to
Is it
go
recording?
up and down. Up and down. Make sense to you?
Yeah.
10 times.
Yeah, 10 times already.
All right. And now we're going to do the same 10 times here. Not like that, but like that. Okay? And I want you to go up and down. I want you to, that your left arm helps your right arm. All right? Do as much as you can with your right arm, but if you feel pain, try that the left helps you. Make sense?
Yeah.
Got my indication?
Yeah.
10 times.
Push with my left.
Yeah. Now I want you to start working on that shoulder, but if it's too painful, like over 4 to 5, your left is going to help you.
Okay.
Make sense?
Yes.
10 times.
Yeah, working on that.
You remember that?
Yeah.
Alright, so we have 2 exercises.
Yeah.
First thing, the pen roll exercises. The second one is with the broomstick.
Yeah.
Okay?
So 3 exercises.
There is 3
This one
exercises.
too.
Yeah.
Okay.
Alright? And now we're going to do isometrics. So I want you to step on the edge of a wall, or probably could do in close to a door. So first thing that we're going to start working is isometric for external rotators.
Yeah.
Pain only till 5, 4 to 5, not over that.
Yeah.
Make sense? So you're going to push the wall with your arm and you're going to count 5. 1, 2, 3, 4, 5 and release. 1, 2, 3, 4, 5 and release. Okay? Now you're going to keep your elbow at 90 degrees and try to keep your shoulder close to your chest. Alright? And 1, 2, 3, 4, 5, release. And you're going to do that 5 times. 3, 4, 5, release. Pain?
Not much.
Not too much?
It's alright.
Cool. Great.
Five.
Alright. Same thing you're going to do now for internal rotation. We already did external rotation. We're going to do internal rotation. So you're going to hold on the wall and press against the wall. 1, 2, 3, 4, 5 and release. Alright? Four, 5 and release. 1, 2, 3, 4, 5 and release.
Yep.
Yep. Remember, 5 times, holding 5 seconds. Okay?
Yeah.
Cool. Now, you are going to hold, you could do, with a pillow, a small pillow, or even a sock.
Yeah.
Try to make a fist. Release. Make a fist. Step really straight in front of you, the wall. Remember 90 degrees. And push against the wall. 5 seconds. Pain at all?
No. Not
No? Great. 4, 5 and release. One more time. 1, 2, 3, 4, 5. Alright, release. Last time. 1, 2, 3, 4, 5. Good job. Now, an extension. So you're going to put the pillow there and try to press. Make sense?
Yep.
All yours. Alright. Now, Dennis, you are already seeing what activities can you do without pain. This isometric is going to reduce your pain, but also it's going to keep loading that tendons and sort of strengthening the rotator cuff muscles. Okay?
Yeah.
We need to start building the strength of the rotator cuff in order to allow healing, but at the same time allow this tendon to start repairing itself and start to building up more stronger.
Yeah.
Make sense?
Yes.
Okay, so now that you are there and we could use this. Let's pretend that there is a belt here, and you can use a belt or whatever you have at home, maybe a rope or something like that. Let me show you. let's pretend that you are attaching this to somewhere at your house.
Yeah.
Alright? So both hands at the same level, and you're gonna try to squeeze your shoulder blades together.
Yeah, alright.
Make sense? 1, 2, 3, 4, 5, and release. 1, 2, 3, 4, 5, release. Got it?
Yep.
All yours.
With a rigid band then.
Yep, something rigid.
Okay.
Something rigid, it could be a rope, it could be like a belt, you know, whatever. I don't want you to go and stretch yourself. Just keep yourself there and try to just squeeze your shoulder blades together. If I put my finger in between your shoulder blades, I want you to squeeze my fingers together. Yeah, hold that 5 seconds. 3, 4, 5, release. One more time. 1, 2, 3, 4, 5, release. One more time. 1, 2, 3, 4, 5, release. And the last one. 1, 3, 4, 5. Cool. Any problems at all?
No, it's alright.
It's alright. You want to have a seat back?
Yeah.
So we can see how your shoulder is doing now. If you could rate your pain now after the exercises, how would you rate your pain now?
I think it's like 1 or 2.
Alright, and before it was?
Maybe like a bit more, like 3, 4.
So you reckon the pain improved a little bit, is now better?
Yeah.
Are you okay with your shoe?
Yeah, I
It's
think
falling
so.
apart.
That's alright.
It's alright, cool. Yeah, cool. That was one of your goals, so I'm happy with that. It is also showing you what sort of activities are you able to do, what your shoulder is able to do.
Yeah.
And I want you to start focusing on that, Dennis, because that is going to tell you how far you can go with your shoulder.
Yeah.
First thing. So I want that the pain guide you in terms of I don't want you to go over 5 out of 10.
Yeah.
Make sense?
Yes.
All right. So at work, at your home, whatever. If you are driving, same thing.
Yeah,
Don't go
at
over.
the work when I have to do like hard work. It's definitely go higher than 5. It's like go like 7 sometimes.
We need to modify that. We need to modify the duties that you are doing, and that could be either you doing lighter duties, you know, talking to your employer and doing lighter duties, or you could do either just using your left arm. You know what I mean? Or try to use more the left arm rather than the right one. Make sense to you?
Yes.
I want you to you keep in mind your ergometrics, and you're not gonna. I not want you to hurt your back or you overexert the left, because if the left is going to take all the pressure, then that's not also good for you. Because then you're gonna have problems with your left shoulder. Does it make sense to you?
Yes.
So the first thing that I already offered you, but if you're happy, I can write a letter for your employer stating what I found on you and stating what things needs to change in order to allow your shoulder to heal. So probably we'll be moving you to lighter duties, or stopping you from lifting heavy things for a while, because you know tendons takes an average six weeks average. Each person is different, but 6 weeks to heal properly. And yeah, it's gonna take around 5 to 6 weeks in order to you to get back to that the tendon itself is being able to support all the tasks that needs to support for your duties.
All right.
Does it make sense?
Yes.
All right. So in the meantime, I'm happy if you can offload that shoulder, work on the same exercises that we discussed today. and I want to summarize them for you. All right. So the first one is gonna be the pen write exercises.
Yeah.
You can write down the alphabet if you want, and you can do back and forth, side to side, 10 times each. All right. With a broomstick, you can do anterior flexion, and you also can do abduction.
Yeah.
Remember that the focus is activating the muscles, but do not go over 5 of pain. So if the pain is going too much, maybe you can start, helping with the left one. Okay? That's the first and the second one. The third exercise is going to be the isometrics. But I want you to do the isometrics holding 5 seconds, and that's going to be 10 times. We did 5 times here, but I want you to do at home 10 times.
Yeah. Right.
All right? So it's going to be 10 times for external rotation, internal rotation, anterior flexion, and extension.
Yeah.
Make sense to you?
Yes.
10 times holding 5 seconds.
All right.
All this, wrapping this up is going to be range of motion exercises plus isometrics. And the last one is going to be
The one with the shoulder.
Yeah, with the shoulder. Okay?
Yeah.
So that's the third one. This is going to be
Gonna
one
write
session.
this for me.
Yeah, sure. I'm gonna as soon as we finish our session, I'm gonna write this up and email you with all the specific indications. But I want to make sure that you understand what each one of those means.
Yeah, beautiful.
And I want you to do these exercises or this session 2 sessions a day. Sounds good to you? So you could probably do it one in the morning and one in the afternoon or evening.
Yeah.
Depends on your workload.
Okay.
Okay? Is there anything else that you want to achieve want to ask today?
Should I put eyes? Should I put any eyes or?
Have you ever applied ice or heat on
Not
your
really.
shoulder?
Not really.
You can try. You can try with heat, and if it feels alright for you, you can keep using heat. If you feel like the cold is better for you and it reduces and soothes pain, maybe you can keep using the ice. Because there is no difference in ice and heat, so you can use either of those.
Alright, yeah.
If it reduces your pain, okay?
Yeah.
So, I already assessed your level of pain, but I want to check how is your range of motion. Alright, pretty much the same. Doesn't make much difference. Alright. What about the external rotation? Beautiful. And internal rotation, you can do it like that. Alright. Just a slight improvement on range of motion.
That's annoying.
Yeah, no, it's going to be really annoying. But this is something that we are going to still working on, especially, the pendular exercises and the range of motion exercises is going to start reducing the inflammation and the swollen joint there.
Yeah.
Okay?
That's good.
Today is Thursday. I want to see you on Monday.
Okay.
Okay? And probably I would like to see you two times a week.
Okay.
Okay?
Yeah.
Cool. See you, Dennis. Thanks for being my patient.